Guys, welcome back to your girl's channel. So this video is very important. Did you know that September is National Sickle Cell Awareness Month? Probably didn't think so. So I have sickle cell. What is sickle cell? Cell is basically an inherited disease that you can only get from your parents genetically. It is not contagious, so let's get that out the way. It has to deal with your red blood cells. So a normal person's red blood cells is a very beautiful circle and it flows through your veins very well. But with somebody who has sickle cell, their red blood cells, which carry oxygen throughout your whole body, are shaped like a banana. And then they get sticky and they cluster together, which causes pain, which is the main symptoms that those with sickle cell, have. What other symptoms do we have aside from pain crisis, which are super stressful and complicated? We have fatigue, anemia, low energy. You have people with delayed growth, people with vision problems, which I'm starting to have. People who have swelling in their hands and their feet. And so it becomes complicated because the complications that we can get from all of those things are stroke, acute chest syndrome, which I had 2 years ago, but that's a whole different video. Organ damage because your organs are not getting the amount of oxygen they need because your red blood cells are shaped differently and it takes forever for us to reproduce them. You can have blindness, ulcers, gallstones, and pregnancy complications. I have pregnancy complications with all 3 pregnancies. So a lot of people have been told that they cannot live past a certain age or have kids at all, and very limit to what we can do in life, period. But we must always think ahead. I'm not limited to what I can do, although I am, but let's just think that way. So how do you know if you have sickle cell disease, or how do you get diagnosed with it? When you're born here in the US, they have to test you. Every newborn is tested. You can either have the condition or you can have the trait. My son has the trait. And so that's the only way, is through a blood test. You can ask your PCP or reach a hematologist and they will do a special testing for that. There are medications that some people take for treatment. I will put some links in the description so you can read about those to not make this video a little bit longer. People get blood transfusions monthly or weekly to help with their anemia, and that's like really helpful, really helpful. There is a cure, bone marrow transplant, and then obviously that's very costly and you have to find a match, which is very difficult, especially because your insurance does not cover that. So our lifestyle basically consists of drinking folic acid, drinking a lot of water, avoiding extreme temperatures from the hot to the cold and the cold to the hot. Aside from that, you have to have a very well support system, somebody who understands. And then we cannot exercise to the fullest. I've tried that and I end up throwing up each time. So I've decided that it's just something that I need to just avoid, period. Yeah, and then so I want to ask of you guys if you can just, for the month of September, just share the video. Wear red. Red is our color. It represents us. I would really appreciate it. This will be so much support to just share the video, raise awareness for sickle cell patients like myself. And yeah, thanks for watching. Thanks for the support. I look forward for you to share this video.